All right, let's pick up where we left off with talking about schizophrenia. Schizophrenia is a pretty severe condition that actually affects about 1% of the population worldwide, and both men and women are affected equally in this. And it also doesn't make many distinctions among races or anything like that. So this is pretty common as far as 1%, worldwide is quite a lot of people. Anyway, as far as the causes go, got a big question mark here because really they don't know for sure. Okay, nobody really knows for sure, but they have seen some familial cases of this, and that has like a little bit of an asterisk with it because they say that there's like a genetic predisposition to this that you would see in families, but really most families, you don't have a family history with schizophrenia. So most people with schizophrenia do not have a family history with it, except for the notation that if you have a first-degree relative with schizophrenia, that actually increases the risk of getting it for schizophrenia for 10% higher. Or now you have a 10% risk, I guess. If you have a first-degree relative, now you have a 10% risk as opposed to that 1% risk of everybody else in the world. So there's definitely something going on there. Not exactly sure what the familial part is, but the genetic and environmental, it looks like, takes both of them. Now, again, they don't really have a genetic chromosome or anything that they have linked schizophrenia to, at least definitively, but they say that there are certain people with a genetic predisposition, as in it takes something to set it off a little bit if they are already kind of predisposed to getting schizophrenia. So what are the things that can kind of cause this? Well, first off, they start saying that, because of the genetic thing, that there's maybe something about that there's some genetic component, because they do know that monozygotic twins, as in twins that came from the same zygote, have a 50% concurrence rate. Okay, so if one has schizophrenia, about 50% of the time the other one will too with twins. Okay, so there's something definitely there. There's also environmental factors. Okay, and that kind of breaks up in two different kind of groups here, where it could be severe social stress or something like that. So maybe somebody is, suddenly unemployed, or they have to leave home for the first time, something like that with social stresses that can kick off or increase the chance of somebody actually getting schizophrenia, even if they may have been predisposed to it somehow before. But also there's in addition to that severe social stress, there's also a biochemical stress, and as in like drug use or something like that. And the main one that they're pretty sure about that causes a kick off of schizophrenia is marijuana. Okay, so that is one thing that they think marijuana, M-A-R-I-J-U-A-N-A. Okay, that marijuana actually can cause a initiation, I guess, of schizophrenia. Okay, so you have those things that are kind of related to environmental factors, and then of course you have the genetic part. Now, like I said, there's a genetic predisposition to getting schizophrenia, and there's a lot of things that could do that. I mean, it could be, intrauterine, as in still in the uterus, and maybe the mother had exposure to starvation or famine, or even influenza virus during the second trimester. Those are pretty high risk factors. There's also low birth weight could cause a person to develop schizophrenia if they were predisposed to it. Or actually, this is what predisposes people to it, is like a low birth rate, weight, or maybe an Rh incompatibility with the Rh factors in the positive and negative blood. Along with that, as hypoxia during birth could cause a person to become predisposed to schizophrenia. Okay. What else you have? There's other postnatal complications that, again, hypoxia, things like that. Maybe a viral central nervous system infection could cause somebody to be predisposed to getting schizophrenia, as far as that goes. Okay. So, like I said, there's also a biological association with schizophrenia, and this is one of those who came first, the chicken or the egg kind of thing, because they do know that schizophrenias have enlarged ventricles in their brain. Okay, so the ventricles that carry the cerebrospinal fluid, those are enlarged in schizophrenics. Okay. It also, they have a decreased size of the hippocampus, which is where memory is. And they have a altered activity of dopamine, the neurotransmitters dopamine and glutamate. So those three things are anatomical. They are sure that schizophrenics have these abnormalities that are physical, anatomical, biological things in their body. But again, they're not exactly sure if schizophrenia is caused by these, or after becoming schizophrenic it causes the brain changes. Okay, so that's just some of the things here. As far as the signs and symptoms, there are actually four different signs and symptom categories. So the symptom categories, they actually are: positive is the first one, negative is the second one, disorganized is the third, and then the fourth one is cognitive symptoms. So they kind of break them up in those four categories of positive, negative, disorganized, and cognitive. And when you're talking about positive symptoms, you're talking about an excess or distortion of normal functions, like the delusions or hallucinations. Okay, so hallucinations or delusions would be part of that positive signs or positive symptoms of kind of schizophrenia. Okay, the negative symptoms would be what you would have, like loss of normal functions that they at once had. So all of a sudden they would have poor eye contact and lack of expressions on their face. Maybe they have a decreased speech, so they're not speaking anymore, or when they do speak, they have really terse replies to the questions that you ask. Okay. Another one, the third one is disorganized. So you're talking about disorganized thought disorders or bizarre behaviors. An example of maybe a thought disorder is like somebody just has rambling speech. It goes on and on and on and makes no sense at all. Okay, so that would be the third category, disorganized of symptoms. Or they throw it into, cognitive would be the fourth category, where everything is pretty much decreased, and you have decreased attention, you have decreased processing speed, decreased working memory, okay, decreased abstract thinking, or decreased problem solving. So again, the symptoms, the categories of them are kicked into positive, negative, disorganized, and cognitive. But these are the ones that you hear about the most, obviously, is the positive, where they're having these hallucinations or delusions. And as far as the hallucinations go, you can have auditory as in hearing, visual as in seeing things, or tactile. This is a famous, they think that maybe spiders are crawling on their skin or something like that. Okay. Again, there's paranoid schizophrenia, where they actually believe other people can hear their thoughts. You get a lot of this, with patients that are pretty sure that they've been abducted by UFOs, or that everybody's out to get them, the FBI and that sort of thing. Okay, assuming the FBI is actually not out to get them. Okay, the onset, as in when this kicks in, is actually the average age of onset for males is 18, and the average age of females for onset is about 25 years old. Okay, so you 16 to 30 or so is typical, and if you don't have it by 45, you're pretty safe. You're not going to get schizophrenia. So that's about how that goes. I mean, it rarely does start early in childhood, but it certainly can start in childhood. I've definitely heard of cases at 10 years old or so that they started with schizophrenia. And actually, I think this video down here, I think it's, if I remember right, it was somebody that was pretty young that had schizophrenia. All right. Again, that paranoid schizophrenia, by the way, is one of 5 different subtypes, and paranoid schizophrenia is one. The second subtype is disorganized, what I was talking about the speech, behavior, the flat, inappropriate affect. So this is somebody who's just completely disorganized speech and all that sort of stuff is, I guess, the easiest way to remember that. The third subcategory of schizophrenia is catatonic. That's where they just don't move. They kind of, stick themselves in place like a statue or something, and they just stay there. Or maybe they posture in some weird position and just completely stay like that in a weird posture. There's the fourth one is they call it residual, and basically what that is you had schizophrenia sometime in the past, and it was kind of like full-blown schizophrenia, and then you kind of get better, but it's still kind of hanging out there. Okay, so that's there, and then of course the undifferentiated is just a mix of some of the ones that are talked about above on those things. Okay. What else about schizophrenia? Do you know that about 10% of them end up committing suicide? Okay, and you always hear about the violence. Well, they have about a moderate risk for violence. More than likely, they're going to be threatening violence to somebody or a little screaming outburst or something, but their risk of violence is actually about moderate. It's certainly not low like most people, but it's not as bad as you might see or hear about on TV or something. Okay, so how do we test this? How do we diagnose this thing? Well, mostly schizophrenia is clinically diagnosed. So you look at their history, you look at the signs and symptoms, and as far as the signs and symptoms go, you have to have 2 or more of the characteristic symptoms that we talked about. Like you have to have 2 or more of delusions, hallucinations, disorganized speech, negative symptoms that we talked about, or bizarre behavior symptoms, and they have to be for most part of a month to be able to qualify as one of the criteria for diagnosing schizophrenia, is those characteristic symptoms that we just mentioned. Another thing would be that you have to show signs of illness in a social or occupational or personal care impairments in those areas. So you'd have to, some kind of illness in personal care or social or occupational or something like that, where they just can't function in those areas. And that impairment has to be like 6 months or more, with at least 1 month of that 6 months being in an active state, they call it, where you're simply a mess, full-blown impairment in those social, occupational, or self-care areas. Okay. Of course, you have to rule out other physical causes. Okay, again, drug abuse, something like that is definitely something that might get confused with schizophrenia because they're just really, really high on drugs or something like that. Okay, and of course, you look at the neuroimaging. Again, on the neuroimaging, you're going to see issues with the enlarged ventricles and that sort of thing, but they're not necessarily diagnostic for schizophrenia. You do see those in other things also. So again, schizophrenia is one of those, you got to rule out pretty much everything else and look at the history and see if it makes sense. Okay? Now, Wernicke-Korsakoff syndrome, okay, it's completely different, although they do end up with some of the same kind of signs, I guess, is that it's also called Wernicke's encephalopathy because it's a brain issue. And what you do is you lose some brain function because you don't have thiamine or vitamin B1 in sufficient quantities. Okay, they call it wet brain. Actually, this PowerPoint is the first time I've ever heard wet brain. It's usually called wet beriberi, or even dry beriberi is a different kind. But anyway, but wet brain, whatever, due to association with alcoholism. Okay, now the alcoholism is, do I have that written down here somewhere on this slide? Okay, yeah, here it is. It simply just interferes with the thiamine absorption. Okay, so that's one of the things where chronic alcoholics will have not very much B1 or thiamine because the alcohol interferes with it being absorbed, and you do that over a long period of time, then you don't get any B1, you don't get any thiamine, and hence you end up with Wernicke-Korsakoff syndrome because of the damage that causes. Well, what kind of damage does it cause? Well, oops, hang on. Okay, actually, let me get on before I talk about the damage that it causes, because it causes alcoholism is only one. AIDS is another one cause of this Wernicke-Korsakoff syndrome. I'm not really sure what they're talking about the weight loss procedure. Okay, I know what they're talking about. Again, it was for the same reason, where you're interfering with the absorption of any kind of vitamins, and B1 being one of them. So I guess it's possible, not incredibly common, that's for sure. Okay, and then this extreme nausea and vomiting, of course, if you can't keep your food down, hyperemesis gravidarum. If you can't keep your food down, then of course you're going to run into the same issues with the absorption problem, right? Okay. The signs and symptoms. Okay, let's finally get on to that. Confabulations. All right. So what happens is that this thiamine deficiency causes problems in the brain. I believe it's the hippocampus that you can't remember. Okay, it's like having an alcohol blackout, but it's a blackout that well, I guess a blackout where you can't remember something, but the brain kind of makes it up because there's gaps now in the memory, and so the alcoholic, or not necessarily alcoholic, the person with Wernicke-Korsakoff syndrome will actually confabulate a story or put something, rewrite history, I guess, into their own mind to make up for the info that they can't remember. Okay, and as far as they're concerned, they're not lying. Their brain just literally fills in the blanks and puts something in there about what happened during that time that they can't remember. Okay. Now again, it's a memory issue is really what it comes down to, and you can't make new memories, or you can. I guess there's problems with making new memories, and of course because it is a brain issue, I believe in the hippocampus. That. These memory changes. You also have some structural damage with coordination and visually structural damages on the brain as far as that goes too. Okay, Anyway, so testing, obviously you can test for the thiamine levels or the vitamin B1 levels. If it happens to be due to alcoholism, you do your liver function test to find out if there's cirrhosis or something because of the chronic alcoholism test. A pregnancy test. Okay, so if you have somebody who is pregnant and going through vitamins like crazy and they didn't realize that they were pregnant, then you know that's an easy one. You fix that, hopefully. Thyroid stimulating hormone, T3, T4. Okay, you're going to want to test that just to make sure that they don't have some kind of thyroid problem that is acting like a Wernicke-Korsakoff syndrome, where you're getting a bit delusional there. All right. MRI, probably not really needed in this case. It's probably not going to be that useful. Okay, so what do? I mean, if you end up with the decreased thiamine and the patient's confabulating stories and that sort of thing, then you just kind of go with giving them more B1. You know, give them more thiamine, and that will stop the destruction, but it's not going to reverse what damage is already done because, as you know, brain tissue, especially once you destroy the nerve bodies, don't get to be repaired. Okay? Yeah, I guess that's kind of how it works. The pathophysiology of it is kind of right here, where thiamine helps produce energy needed to make the neurons function properly. So if you don't have enough thiamine, then the neurons simply get damaged or they die. Okay? That's why it's not reversible. Alrighty, stroke. Okay, again, stroke is always pretty much the same, but I mean, you don't have to stroke out a brain, although that's the one we think about all the time. Anything can have a stroke if you have a decreased blood flow, but typically we're talking about the brain when you talk about stroke. So we're going to talk about it here as stroke to the brain. Okay, so what kind do you have? Well, you have ischemic stroke. An ischemic stroke is just because you did not get oxygen to that tissue, and that would be from an embolus, possibly, blood clot, and from a thrombus, blood clot that once it travels, it starts moving, then it turns into an embolus, and then you get that embolus stuck somewhere. And if that embolus gets stuck as it's traveling through your arteries or whatever and gets stuck there, then no more blood can go to the rest of that area. And if the blood can't go to the rest of that area, of course, it dies. So that's ischemic stroke. Hemorrhagic stroke, again, same net effect when you're all done with it, but now it's because you're bleeding. So maybe an aneurysm popped or dissected an aneurysm. Maybe you had some kind of hemorrhage in the brain, maybe a subarachnoid hemorrhage or arteriovenous malformation where the arteries and veins are not connecting right. That's down here where you would see like blood flow going that way, and then you get your arteriovenous malformation sitting in here, and it just simply doesn't, if you notice it's supposed to go into smaller, like you can go into smaller arteries right here, and then you go into little capillaries, and you can exchange your oxygen back and forth through the capillaries, and then you end up in the veins, and then you go through, right? Well, arteriovenous malformation, you're missing all of that little stuff in there, so it just continues to go on. Anyway, so obviously if you can have too much blood go through there and it hemorrhages, and if it hemorrhages, then of course you would have the same problem as you would with a dissected aneurysm, where all of a sudden the blood kind of flows in there. Once that blood flows in there, you end up with the same net effect as you had before, but now you have bleeding in the brain, and that bleeding in the brain is going to not let the blood that was supposed to be in those arteries travel through to where they were supposed to go. So again, you end up with ischemia anyway. Okay? Signs and symptoms of stroke, there shouldn't really be, a TIA, we didn't talk about, did we? The transient ischemic attack. Okay, that's like a mini stroke is what they call it, where it's a stroke, but it's less than 5 minutes, so things didn't really die. They just kind of seemed like a stroke, they kind of, maybe the blood clot or whatever it was got going again, and blood flow got reestablished, and there's no permanent damage. So that's a transient ischemic attack is what they call it, transient, because it's pretty short. Alrighty. The signs and symptoms of a stroke are the typically ones I think most people are familiar with. So you got difficulty walking, you got difficulty talking, difficulty seeing, difficulty memory, headache, paresthesias, paralysis. Again, there's a lot to this, right? So you're usually, again, it's one side of the brain or the other usually. So if one side of the brain is affected, then the opposite side of the body is going to have the problem walking, or maybe half of the mouth, or maybe, vision on one side is bad, or, again, it just really depends on where it strokes out. Paresthesia is a broad word for nerve problems. And paralysis, of course, is paralysis. Usually we're talking about hemi, as in one side of the body, because the stroke is only on one side of the brain, right? Testing, that's pretty straightforward, right? You CT, MRI, if you have a stroke in there, no matter what it is, you can definitely see what the big old dead part of it is. And the carotid ultrasound, maybe we're talking about, the carotid artery going through there, and you're looking, and maybe you can find some plaque or something build up in the carotid arteries before it branches off into the smaller ones. Okay? Again, there's nothing really here other than kind of a cool mnemonic to remember it. So signs of stroke, is S for speech, T for tingling or numbness, the nerves things, the R for remembering, problems with thinking, memory, O for off balance, you're staggering because half your body's basically not getting nerves, K for killer, headache, and E for eyes with problems, okay? So that's just a kind of a cool little mnemonic. Okay, moving on to Parkinson's disease. Parkinson's disease, of course, is made very popular by some of the celebrities who've had it, like, Michael J. Fox and Muhammad Ali. And what it is, of course, degenerative, as in it doesn't get better, but the problem goes all the way back to another neurotransmitter. This is dopamine, right? So without dopamine, this neurotransmitter, you can't really,